Um, okay, so pretty much what we're going to go over is some basic exercise phys. We're going to talk about some common sports injuries and hopefully how we can prevent them from a like strengthening perspective and also just making you as a human a little more resilient. And then what happens if you do actually get hurt, which fingers crossed doesn't happen. So general exercise phys things. There's kind of two things that we're looking at when we go through this slide. We're going to talk about what your load is, so what we're putting into the system, what essentially like how much load we're doing, like how much we're exercising, where we're exercising, uphills, downhills, that kind of thing all contributes into your load. And then your capacity is how well you can tolerate that load. So a whole bunch of things go into what our capacity reservoirs are, kind of our experience doing that activity, how much sleep we're getting, what our nutrition is looking like. Are you sick right now? Have you been hurt recently or previously? So as we kind of go through these slides, you're kind of thinking about load and capacity and how they relate to each other. This is a nice little graphic. Like I said, this is all in a balance. So you can increase your load. You can push yourself to do hard things. You can make your volume really high, and that's great. But we want to make sure that the capacity that we have to accept that load is there. So things that kind of influence our load are volume, like how much are you doing of that activity, what your pace is like. Are you going faster than normal? Can we slow it down so we can tolerate a larger volume? What is the terrain like? Are you running on a road? Are you running on a trail? Are you switching up your terrain all of a sudden, which happens a lot maybe as we go from spring or winter to summer and we're thinking about like maybe I've been running on a treadmill and now I'm running on a trail and how that terrain is different. And then what are our mechanics? And then capacity, like we kind of talked about, or I kind of talked about 5 seconds ago. Experience, prior injury, sleep, nutrition. Are you sick? What's your strength like? There you go. So things that you have control over, right? Like we don't always have control over how much experience we have doing something. Maybe we just picked up mountain biking. Like there's nothing you can do about the fact that this is the first or second year you've done that. But we can change some of our risk factors, like minimizing our training errors. So at least being mindful of how we're loading our bodies as we go into something new, improving our sleep or taking into consideration like what your sleep has been like. So if you had a couple of nights of really bad sleep, maybe it's not the day to say yes to a 50-mile bike ride the next day, things like that. And then making sure we're really on top of nutrition and hydration, both when we're not doing the activity and then also during the activity as well. And keeping up on strength and mobility just to make sure that you are super strong as you start to do that activity. I'm going to get this at the end. Okay. So injuries, especially when we talk about like overuse injuries, often occur more when that load is too high and the capacity is not enough to meet that load. So a lot of times, maybe you are doing something that you've already done. You know, you're like, last summer I did this same kind of thing, but maybe my capacity is lower. I'm a little more stressed, or I'm not taking care of my nutrition as well, or I'm not sleeping as well. So always thinking about like load and capacity in relation to each other. Some of these common injuries are just general sprains and strains, broken bones, which are a little more traumatic and maybe not as easily reduced with sleep and nutrition, but still important to keep in mind. Tendinitis, dehydration or heat illness, which definitely you can hopefully mitigate by like staying on top of things, and any cardiovascular things, especially older than 35. Okay, what are some common injuries? We're going to kind of delve into these a little bit as they come up to in a sec, but runners, hikers, plantar fasciitis, so foot pains, Achilles tendonitis, kind of calf, ankle pain, knee pains, so that could be front of the knee pain. It could be kind of in this bucket as patellofemoral pain syndrome, shin splints or stress fractures, IT band, which is like lateral knee pain or patellar tendonitis. And then if you have osteoarthritis, just is that load a little bit much? Are we aggravating any of that arthritis or just overtraining? And then cyclists, things that can pop up also could be Achilles tendonitis, some of that knee pain, whether it's anterior or lateral, back pain and neck pain just from positions, and still overtraining. Feel free to jump in if you have any extra things.
Sorry. Do you guys know, do you know overtraining and what that is and sort of how it looks? You can unmute yourselves if you're there. So if you have never heard about overtraining, overtraining is a really interesting syndrome, which essentially is exactly what we're talking about, that there's too much load and not enough recovery, right? So too much load, not enough capacity. And so it can look like a lot of different things. It can look like depressed mood. It can look like lots of injuries that are coming up. It can look like, oh my gosh, my heart rate is not actually behaving the way that I expected to with this particular load. All of it is associated with injury, and the way we treat it is with rest, right? Recovery. So increasing the capacity essentially and dropping out the load until you're back to your baseline. So just wanted to pipe in with that little tiny bit of info, just because it's a term that not everybody has heard of.
Okay. So coming into one of our first training areas or things that are modifiable is our volume. So there's kind of a lot of information on here. Some of it is a little nerdy, and if you want to get really technical with it, you can. The first one is the 10% rule, which is probably like the easiest thing brain-wise to kind of understand, is just increasing your load by 10% each week. So especially if you, this does get a little harder when you maybe do a lot of activities like we bike and we run and we hike, and it's kind of a lot of load all happening at the same time. And so sometimes that's a little harder to like 10% rule off the top of your head. But for example, if you are mostly running and you are running 20 miles a week, that 10% load would kind of look like adding another 2 miles each week. That being said, the next bullet point kind of talks about how if it's under 30 miles a week specifically for running, like, yeah, if you're running 10 miles a week and you increase it by 10%, you're going to increase your load really slowly. And so as long as you're being mindful, you could maybe get away with a little bit extra. Um, the acute to chronic workload ratio, if um, if you wanted more information, I'm happy to talk about it, but it's essentially looking at what your load is over 4 weeks and then kind of averaging that and looking at the most recent week. And you want to make sure that your load isn't too much on that most recent week in comparison to what you've done in the last month. So the 0.8 to 1.3 is essentially saying you're either doing 100% of that average, maybe a little bit more, maybe a little bit less. If you're doing a lot more than that, you're a little more likely to get injured because you've really increased your load in that last week. And then the 0.8 actually is if you're doing not enough, you also are kind of putting yourself at a risk in the sense of maybe all of a sudden I stopped doing that for a couple of weeks and then I try to go back to what I was doing 3 weeks ago when you haven't been kind of doing that for the last couple of weeks. And that can also be a little bit of a risk factor for getting injured. With both of these, there isn't really like great there's not like very robust research saying this is the specific one that you should follow. But there's kind of a lot of tools out there that you have at your disposal, at least if you want to like write things down or make sure that you're just not overdoing it. On this note, also, there is, I think like one of the training apps, it's kind of like a Strava. They have, I think even Strava does it. If you use Strava, they have kind of your like little graphs for how much you're doing each week. So that's like a really easy way too. If you just pull up Strava and you look at like running, and it'll tell you your graph, and you might see this like huge spike, and then it goes down, and then this huge spike. So that's kind of something just to give you a visual of like, all right, maybe things aren't super balanced as I'm going along my weeks, and I want to think about that a little bit more. So it's a super easy tool to use also. Any questions so far? Keep going. Okay. Okay, so still kind of on volume here. This is just a nice study that looked at if the workload to injury relationship can be improved at all, either with like strength or speed work or sprinting, things like that. And this was just nice because it was looking at athletes who are a little, at least who are stronger, are a little bit better able to tolerate those larger week-to-week changes. And we're going to come back to this when we talk about strengthening, because especially up here, we have so many fun things we can do outside that sometimes it's hard to be like, I should go to the gym twice a week, or I should do some squats in my living room a couple times a week. But maybe those 2 times a week that we do those strength exercises actually gives us maybe a little more breathing room of I haven't been super on top of how much I'm loading myself, but I am really strong and I've built this like robust capacity to do these things so that when I do say yes to that last minute extra long ride, like I'm going to be okay because I've actually been strength training and I'm feeling good and I'm feeling really strong. Yeah, there we go. Okay. So pace, this one is, I mean, a little bit more simple in the sense of like higher pace, higher load. One easy way to kind of mitigate that is maybe we go a little bit slower. Like if you're feeling a little over uh out of your depth on a certain distance or whatever, you can just kind of slow it down a little bit. And that is kind of the sake for biking, hiking, running. And then as far as terrain, this one I think is really interesting because a lot of times, at least in the clinic, like when I see patients, people will be like, oh, running on asphalt is so bad for you. And it's not necessarily that it's bad for you, but if you haven't trained to do that terrain, that's going to feel like a really big change in load because it's a different surface than it is running on a treadmill, which is a little bit bouncier and softer, or on a trail that is dirt. So when you think about increasing your risk, and this also goes for like hiking and walking, um, where you want to just make sure that as you're increasing your load on like mileage, you're also thinking about the changes in terrain and how that might impact what that load looks like, and making sure that you are at least like gradually going to a different terrain. I think about this a lot in, again, that like summer to spring transition where maybe people have been running on the bike path or going on bike path hikes. And then they go to running on a trail, which is maybe softer, but has more uneven surfaces and more like bouncing around, and you're reacting to rocks and things like that. And it's just a different surface. So it's more so just to be mindful about what you're training on. And then if you have a specific racer objective, generally you want to train on that surface. Yeah. Okay. How do we improve our capacity? So sleep is a huge one. Decreased quantity of sleep, not great. Uh, just not great. So looking at some studies, they kind of found like decreased quality of sleep, at least less than 7 hours, leads to increased running related injuries. And this was kind of off of like more of a running related study, but it can be extrapolated just in the sense of like sleep good, we want more of it. So there's a 2-week lag between decreased sleep and increased injuries. So even if you had a week of really bad sleep, or maybe you were up a lot in the middle of the night or whatever it was, kind of thinking about how that might impact you down the line. And then efforts more than 30 minutes were most effective. So especially, again, coming back to those like longer days, or just not a little jaunt in the neighborhood, but you're actually going out for a ride. Like you want to make sure that you're appropriately rested. And so that you're just less likely to get injured.
Can I pipe in?
Yeah.
So just wanted to pipe in with, there's a ton of research on sleep. Mostly, a lot of it comes from the military and recruits who are purposefully, they withhold sleep and then run them, march them, see what happens, right? And of course, the injury rates just escalate. So I think it's just super important. We can't, really emphasize it enough. Believe it or not, some of the NCAA Division I schools now are requiring 9 to 10 hours of sleep for their athletes. They actually have curfew and they are not allowed out in order to get that much sleep. So you can see, like, just in the world of exercise physiology, how important sleep is. And now, honestly, there are no excuses to not monitor your sleep, because man, are they easy with Aura rings and iWatches and Fitbits and like you name it. So they, although they are not perfect pieces of equipment to monitor all of the sleep phases and everything else, boy, they give you a really good estimate of how much time you're actually going through phase 1 through 4 of sleep, and how many times you're waking through the night, and what that really looks like. So it is a really easy tool if you are training for something to, get that information so that exactly like April was saying, like, gosh darn it, if it's been a really stressful week, if you've had to do a ton of stuff for work, if you're not sleeping well, if you're, more stressed, you'll see that on your device, but you'll also see some heart rate changes. You'll see some other, issues that go along with that. And I just think, gosh, in this era, like there's no reason why we can't use technology to our advantage as it relates to those, maximizing your training efforts for sure. So that's it.
Cool. Okay, so I don't know if you guys are familiar with Huberman Lab. Not gonna say everything that he says is great, but he has some really nice sleep information. He has this interview that's like wildly long if you want to listen to like 2 hours about sleep with Matt Walker. Matt Walker also has a book that's up there. But this is kind of a condensed version of how can we maybe work on making our sleep a little bit better. So consistency is super important. It is important to get up at like the same time every day. This can be really hard depending on like what your work schedule is like. I know I personally love to sleep in on my days off, but I try to get up early because I get up on my work days. So it makes getting up on my work days a little bit easier. Yes, amount of sleep is important, but consistency, at least in like the time. So your kind of like rhythmic cycle is a little more normal. The colder the room, the better for sleep. Trying about 60 to 65 degrees helps you just get into that deep sleep. Making it dark. So luckily we're not super light polluted in general, but if you have light or in the summer, if you're going to bed at times where it's still light outside, blackout curtains really help. And then light in the morning also to kind of help your brain realize that it's like up and it's daytime. Trying not to exercise at night. Again, sometimes it's hard just depending on your schedule and maybe all of these things aren't 100% perfect, but if you can avoid working out within 4 hours of bedtime, trying not to like increase your cortisol and get all hyped up right before you go to bed and then trying to immediately fall asleep. So maybe earlier in the day, that way it's just a little bit easier when you do try to kind of wind down. Naps. Naps are lovely. However, if you are not getting enough sleep during the night or you're not getting really good quality sleep, trying not to nap in the middle of the day so that hopefully you can get on like a better routine at nighttime or whenever your sleep cycle is, so that your sleep is actually better and like chunked together then. And then naps can increase your performance, but you have to be getting at least that minimum 7 hours of sleep already. Avoiding caffeine afternoon. Again, everyone is a little bit different as far as how caffeine affects them, but half-life roughly like average is about 7 hours. Again, some people just metabolize it a little bit faster and maybe you're one of those lucky people, but trying to at least pay attention to when you can stop drinking caffeine, trying to not drink it too close to when you're going to bed or in the afternoon. Alcohol and spicy foods. Again, everyone's a little bit different, but trying not to have those like a little bit too late to bedtime to not interrupt your sleep. And then reserving your bed for sleep and sex. Like that is, so your body knows when you go in that room, that is what is that room is for. You're not in there like watching TV or doing a bunch of stuff, laying in bed, so that your brain, when you get in bed, you're like, oh yeah, this is where I'm going to bed. I'm winding down. I'm ready to like chill and not be doing a bunch of stuff in my room. Yeah, so most of this is kind of coming from this talk and also from the book. If you
piping in.
Oh, yeah.
I'm piping in with two things. So Dr. Huberman, in case you don't know him, like April mentioned, he is a neuroscientist at Stanford. He's has an awesome podcast. He interviews really interesting people on various different topics, one of which is sleep for sure. He actually has a great podcast with Stacey Sims, also, who's an exercise physiologist from New Zealand. And I think, he's just a wealth of information. I think it's all based on research. It's not, just his opinion. So something to think about. And then just the last thing with sleep is, of course, we all already know we should put our screens somewhere else, but that goes along with, reserving your bedroom for sleep and sex. Like your bed is not your desk and you should not have your computer or your phone in there. There is some evidence that the blue light blockers can be helpful, but they still do not seem to affect those cortisol levels that April was talking about as it relates to, right before bed. Like you got to turn that stuff off at least 30 minutes before you actually want to get to sleep. That's it.
Perfect. Okay, nutrition. Hopefully you guys are still hanging with us. Okay, we're gonna go into nutrition. So important to have a good nutrition, both like baseline, day to day, and also while you're refueling. I don't think I have it on here, but for refueling, just making sure you're thinking about how long you're going to be out for an adventure, whether it's biking, hiking, running, and making sure you have enough snacks, like simple carbohydrates to help you refuel, making sure you're drinking enough water, making sure you're thinking about electrolytes, especially when it's really hot out. That way you don't get to the end and or middle and bonk and realize that maybe earlier would have been a good time to eat a snack. So talking about protein, these we've discussed are maybe on the like lower end actually, but at least 1.2 to 2 grams per kilogram body weight of protein. If you want to build more muscle, you have to eat more protein. So we want to like feed our muscles and make sure that they're happy and we're not doing a ton of activity and then not eating enough to actually see any benefit outside the like fun and mental health aspect, but like any physical benefit from all that exercise we're doing, we want to make sure we're like feeding our body, feeding our muscles to be able to do that kind of stuff. Fruits and vegetables, important to include, especially for complex carbs, nitrates like leafy greens, root veggies, they have a lot of good things in them. Nitric oxide helps improve blood flow. So especially for activities and also if you're coming back from an injury, like we want to help increase all the good blood flow and be eating those leafy greens, vegetables, things like that. Collagen and vitamin C. It may help improve your tendon or ligament health.
Yeah.
We kind of,
Jury's out.
yeah, not really sure, but it's up there. It's information. If you are interested at all in collagen and vitamin C, I would say do them together if you're going to do them. And it may or may not help, but if you want to add a little extra boost. Creatine. We love creatine, you guys. Dr. Albertson mentions Stacey Sims. If you guys are at all interested, she's like a fabulous resource. But creatine is super important. It helps kind of plump up your muscles. I always tell my patients it like makes your muscles nice and happy and helps them be stronger when you do all your exercises. So we like creatine. It helps with muscle hypertrophy, again, especially if you're coming back from an injury, helps like make those muscles nice and healthy if you're a little more atrophied on one side versus the other. And then the recommended daily intake is 3 to 5 grams per day. I think the minimum effective dosage for women is about 3. So I've had some patients tell me like it upsets their stomach or they didn't really love it. And I said, just bump down. Usually the single serving is like 5 grams and you get it in a powder. Just like do a little bit less of it and see if your belly is a little bit happier. And some things on the internet will tell you have to like have it 3 times a day. At the beginning of it, you don't have to do that.
Correct. Okay, I'm piping in about creatine. So creatine monohydrates is the form that's been most studied, which is why that's what's on our slide here. There are a number of other forms that are available online, but I would not veer off to them. They have no added benefit from creatine monohydrate. The issue with creatine and GI upset has to do with the processing of the creatine. It's actually manufactured. It's a combination amino acid, but it's not an animal product. And so what's interesting about it is that most companies will actually wash the creatine with an acid wash. And it turns out that that's the thing that is actually causing the irritation to the GI. And causing GI issues versus a company that is called CreaPure, and it is the only company that uses a water wash. You can buy it on Amazon. You can buy it at many stores. You're just looking for that little CreaPure label. It's a German company, and they are the only ones that actually use a water wash, and it seems to get rid of the GI issues for most people. No reason to go higher than 5 grams, but that being said, it does take some time to get to the steady state in your muscles. So it takes about 2 weeks. And then at that time, what you're going to notice is that, hey, now you can actually lift heavier weights. So before, when April was talking about increasing your capacity and increasing your strength, that's what creatine's doing. It is not anabolic. You still got to do the work, right? You're not going to sit on the couch and get stronger. You still have to do the strength training, but now all of a sudden, instead of doing a bicep curl with 15-pound dumbbells, now you can get 8 reps with that 20-pound dumbbell, and that extra muscle that you're gaining from doing the heavier weight is yours to keep, right? So I get asked a lot, like, what if I miss a dose of creatine? Okay, not a big deal. You've already reached your steady state. So if you miss a day or two here or there, it's not the end of the world, but it is one that you can just stay on every day. That's it.
Perfect. Some resources listed below. Tara is a dietitian and she actually works through the wellness center, and I think you can like book consults with her, and she actually gave me a bunch of information that's on this slide originally. So if you have any like personalized information that you are looking for, she's a really good resource. She also I think like specializes a lot in like sports nutrition. So if you have a big event or something coming up and you want a nutrition plan and you want someone to tell you like at minute 45 you need to eat these 6 gummies or whatever, drink this much water, like she's a really good resource for that too, if you don't know where to start with that kind of stuff. Faster Female Athlete Science and Translational Research Group is out of Stanford. They're like a great Instagram follow. They have webinars and things like that that are on a lot of topics, but if you're looking for more specifically like women's information, that's a great one. The U.S. Olympic and Paralympic Committee Nutrition. I think there's just like a picture I put on the next one that we can look at, and that's where I got that from. And then Stacy Sims, like I said, or we said, she's great. We love her. Look her up. Okay, so this is kind of the 2 on the left. Yeah, hopefully that's still your left. Your guys' is left. The all about fueling and hydration during and post workout. These are just examples of some of those resources on the other slide. So the kind of like blue ones are from Faster, and the other one is the athlete plate that is from, I think, the Olympic Committee. Any questions yet? Okay. Okay. So still kind of on the nutrition aspect, I'm just going to briefly talk about LEA, or low energy availability, which is when your food intake does not match your expended energy, which just can really impact you as far as so many things. Just like your recovery, your ability to kind of keep improving in whatever activity you're doing. If you are doing all of this great work, or you're having all these really fun bikes and runs, but you aren't seeing improvement and you're not eating enough, it could be from low energy availability, where you're just using all this energy and not putting that back into your body, right? So when we talk about that balance scale between load and capacity, your load is way high and you're not refilling that capacity bucket on the nutrition side. This is like a nice graphic. This is also a great follow. He's a PT, so I'm obviously biased. I think he's great. But Montana Running Lab, and he doesn't just do running things, but he puts a ton of information that's all just studies on Instagram, and it makes it like fun graphics, easy to digest if you don't want to go read a whole article about it. But specifically, this was kind of talking about runners also with low energy availability. It is also pretty, I don't want to say common, but like it's not unheard of also in cyclists and in general, where we're just not eating enough, whether it's for the fact that we like want to be lighter for whatever activity we're doing, if that's the mindset, or maybe you're trying to lose weight and you're also doing these activities, like you got to be eating enough to do it. And without enough nutrition input, you're putting yourself at a higher risk of stress fractures. If you're female, you could get some like menstrual disruption from your cycle from like not eating enough and just not being replenishing everything as much as you're going. Okay. Going in circles. Great. Okay. Running. So we're going to talk about running related injuries. Most running related injuries are overuse in nature rather than traumatic. So running is going to be a little more overused. Biking tends to be a little more traumatic, accidentally, just due to a fall. But for running, we've kind of got these main 6 injuries that we see the most. So knee injuries and lower ankle foot injuries kind of take the most of it. And then bone stress injuries, which going back to the low energy availability, like low energy availability, low nutrition, or not replenishing enough just puts you at a high risk for those bone stress injuries. As far as the knee injuries, the most common ones are just like the bucket of knee pain, that's patellofemoral pain syndrome, or IT band syndrome, which is like that lateral knee pain. And then lower leg things would be shin splints or Achilles tendon pain. So it could be tendonitis where it's really acute. It could be tendinopathy that's a little more chronic of a thing that's happening, or plantar fasciitis, which is bottom of the foot pain. And then golfing things.
So I get golfing, even though I don't golf. I joke with my orthopedic counterparts that I have yet to join their club. So that being said, golfing, obviously a lot of that, torso rotation. If you don't have the strength, you don't have the stability, then unfortunately you're overloading joints, you're overloading discs. And so it's really common that we see some back strains, muscle strain in the low back. And then, of course, we've all heard about golfer's elbow. It's a medial epicondylitis. And just like the other tendinitis, when you're not, when your capacity is low and you're not actually training appropriately for your sport, then your risk of a medial epicondylitis or a lateral epicondylitis, which is tennis elbow, is higher. I think it's something to keep in mind for all of us with our older patients, right? Because the mindset of strength training for a golfer. We can thank Tiger Woods, thank God, for his, incredible comebacks from some giant injuries in his spine. And he has truly led the path of showing golfers that strength training is critical for the game, right? That being said, I think for our, 60, 70, 80-year-old population, strength training may not even be in the vocabulary. And so kind of bringing that to their, attention and just sort of saying, hey, this is actually going to take strokes off your game and actually improve your capacity and decrease your injury risk. I think it's really, really important that we kind of come at them from a perspective of, not only minimizing injury, but maximizing performance.
Okay. So some things to help prevent injuries. Getting a good baseline of where you're at. So for the functional movement screen, this is like a general, you're looking at like a bunch of different movements, seeing kind of like if you're looking more so normal or how we can kind of address some of the imbalances that may pop up in this movement screen. The tit least is more golf related. And then the Wingate assessment is another one for aerobic things. And then you want to see how far you've come, right? So you always want to test and retest and see if you are improving, if you're hopefully improving, staying the same, if things are regressing, which would be kind of a bummer, but at least looking every 6 to 8 weeks so that you can kind of make sure that you're hitting the mark or at least kind of on the right track as we're going through, whether it's the season or just the year or your journey in the sport. You're getting a little bit better every time. Okay, parameters. So things to kind of consider. There's a bunch of different parameters for your strength training. We are kind of looking for this kind of topic in particular. We're looking at building strength. So kind of looking at the graphic on the side, especially if you're doing a more cardio heavy, like a biking or running or hiking, you're already doing this muscular endurance activity, right? You're already out there for an hour or 2 hours doing an activity. So you don't need to go to the gym and then also work on muscular endurance. You can, that's great, but that's not our goal. Like if we're looking to just supplement our outdoor recreation activities, we want to look at building strength, getting the most bang for our buck if you're going to set that time aside, whether it's at the gym or at home, to actually do these exercises. So 1 to 5 reps, which seems low, and it is low because you want to do these reps at essentially 85% of what your 1 rep max is, which you might not know what your 1 rep max is for a squat off the top of your head if you're not testing it, which is fine. But there's some, if you want to get into it, there's some if you just Google like 1 rep max calculator on the internet and you put in how much you're lifting and how many reps you can do essentially before you have to stop with that weight, it'll kind of give you an estimate of what your 1 rep max might be. So say I'm going to the gym and I'm doing a squat with 70 pounds and I can only do 10 of them before I have to stop. And I go in, I put that in and it'll tell me how much my 1 rep max is. And then you can kind of do some calculating for how heavy you actually need to load yourself. And this might feel like a novel concept if you're not familiar with going to the gym or doing a lot of strength training, but like I said, if you're going to set the time aside to actually do the strength training and like try to get better and incorporate these things, and you want to at least be doing it right and not underloading yourself, and not really like seeing the benefit of what we're trying to do. So 1 to 5 reps. So lower reps, higher weight, higher load, maybe 2 to 6 sets. Again, it depends. And you want to give yourself enough rest. So the goal here, like I said, is not muscular endurance. We're not doing like 50 bicep curls in a row. I want to load heavy and then I want to rest and I want to be able to do it again. So I want to load heavy again and then I want to rest enough. Hypertrophy, a lot of people are like, you know, it's easy. We go 3 sets of 10. I'm guilty of this in PT. Sometimes I give people 3 sets of 10. It's easy to remember. And if I'm looking to build muscle, great. Like that's an easy way to do it. But hypertrophy is literally making your muscles bigger. So if that is your goal, say like you're coming back from an injury or one side is a little smaller than the other side because you had a knee injury or a surgery or whatever it is, and we're looking to build up strength on that one side, then hypertrophy is a great parameter. But for baseline, just strength training, we want to load a little bit heavier, do lighter reps. The other thing, and I liked this graphic from the sense of like not getting super fatigued at the gym. And I will tell you personally, like I love doing circuits, but then I'll go on a run the next day and I'll be exhausted. I'm like, oh my God, I'm so tired. I can't go on the 6-mile run. And I'm like, oh yeah, I went to the gym and did a 45-minute circuit training. Of course I'm exhausted, which is maybe fine. But if I don't love going to the gym and I just want to go running, I want to make sure I'm not making it so that I'm not having a good time while I'm doing that thing outside. So maybe you don't do circuit training. You want to make sure you do your rest. You only have to do the minimally effective dose. Like be strategically lazy. Like do the minimum you need to see the maximum amount of improvement. So 2 lifting sessions during the week is plenty if you're not into going to the gym, like twice a week. That's all you need. And then you're not trying to lift until failure. That's cool and all. That's not the goal. Like you're just here to build some strength to have more fun doing the things outside. Okay. I guess I'm not going to go through all of these together. These are, you guys should have access to these slides. So this is a really nice way to just like pull up. I made like some template things that you can work on loading, specifically a little more for running, specifically a little more for biking. There's one on there for climbing if you like climbing. And we can send you the directions on how to get to these. Usually my test is if you want to see some single leg strength, maybe deficit side to side, or see how strong you are. Really quick test is just go from sitting in a chair to standing up with one leg and see how that goes. That's usually my quick example for why it's important to work on your strength, especially if you're going to go hike and walk on one leg up and down a mountain, and make sure that each side is equal. For the knee pain kind of bucket of exercises, there's a lot of glute strengthening. There's some single leg stability things. There's things like heel raises, and some clamshells and bridges to get your glutes super strong, and single leg sit to stands to make sure that you can actually go up and down on one leg. In the more like foot, ankle bucket, there's even some things called toe yoga, right? We are probably going hiking in shoes, but you want to make sure all your little toe muscles and your feet intrinsic muscles are super strong. They help support your arch. And then again, more like heel raises and things like that. For biking, some of this stuff is a little more mobility. When we kind of go back to that like bike injury is the back and the neck pain, especially if you're in like a downhill position, right, for a really long time. We're not doing a lot of rotation. We're not doing a ton of extension. So trying to at least like get into those other planes of motion, making sure we're not super stiff. That way you don't wake up the next day and not want to go on a bike ride because your back hurts or your neck hurts because you've just been in this one position, like bumping around for a long time. Kind of similarly on there is also some big step ups, I believe, just working on that like strength to really do that push, especially if you're biking uphill and you're grinding away. You want to make sure you actually have the strength in a single leg to push quite heavy, so you can get uphill. So there's some options on there for some bike strengthening as well. And then there is a little bit of crossover. So some of them have similar exercises if you're into both activities, things like a deadlift, single leg sit to stand, like I said, the step ups and single leg bridges. So a lot of making sure that you are symmetrical side to side, so that one side isn't doing more work or you're not ending up with maybe an injury on one side versus the other. Climbing things, there's a warm-up and some strengthening things. If you are into climbing, this is a lovely resource. Just making sure that you are warming up the way that you would climb, which actually means that you are warming up on the wall. You're using a band to kind of do some of these big motions. You're making sure all your little finger tendons are super warmed up before just like getting into a project and doing little crimpy things. So these are some nice resources also for more climbing-based exercise programs. Okay, what happens if maybe you do too much? Give your body a chance to rest. Stop the loading and actually rest. And this, I always tell my patients, sometimes I'm just here for common sense, and that means listening to your body. And listening to your body is sometimes really hard. So you have to like actually listen to your body, and read what's happening and kind of be mindful. Again, our goal is long term. We want to like be sustainable. We want to be able to live up here and do these fun activities and not have to stop for a whole season or miss like all of ski season or all of bike season because maybe we didn't listen at the beginning of the season and kind of kept pushing through something that ended up taking us out for a couple months. So stop loading, rest. You can try some ice or acetaminophen. Anti-inflammatories, inflammation can be a good thing. Inflammation can help you actually heal. And if you're not getting better, talk to someone about it. Don't just ignore it. Okay, so rice, I feel like everyone is familiar with rice, and we're gonna go for peace and love. So protect, you are gonna protect whatever is injured at first. So maybe don't over aggravate that part of your body, just like take a break. Elevate, so out of rice, the two really like great ones we're gonna hold on to are elevate and compress. So especially if something is swollen, you wanna put it up, you wanna help with some compression. Avoiding anti-inflammatories, again, like we said, inflammation can actually be an okay thing. It can be a good thing. It can help us like bring good things to that area that's injured and help with the tissue healing. And then education. So that's where we come in also, both of us. If you have questions, like ask us, right? Maybe I always say like don't go down dark internet rabbit holes. Come ask someone what to do and listen to your body. And then you want to love. So then you want to load it. You want to actually do some things and help get back to a normal activity, not just like cut everything out for a week and then, okay, I'm going to go back to what I was doing. We want to gradually load back up. We want to make sure that your body is able to do what we want to do. And whether that's getting stronger, going back into some mobility things. Optimism is key. Like be positive. I know sometimes it's really hard to get hurt and not be able to do the things that you want to do. I think especially when we build community around doing our recreational activities, it can be really hard when we don't have that option anymore. Feels like you hit your friends up and they're out doing whatever it is that you want to do and you can't do it. And it can be really hard. So just think positively, like our bodies are super resilient. We have the tools, like we know how to overcome these things. So just thinking positively. Vascularization. So just blood flow. Like we want to bring good blood flow to what is whatever is healing. So some nice pain-free cardio activities. Maybe that's a stationary bike. If walking feels good and it's not hurting anything, if it's not a lower extremity injury, great, like walking. And then exercising. So mobility, strengthening, like reworking on balance and our stability, especially for our single leg activities, and getting back into what we were doing.
I usually tell my patients, like, this is not a time for you to lose your mind when you have an injury. Like, you do have to work around it. But, when you talk to somebody like us, often we've got all sorts of exercises you could still be working on. And frankly, then when you get the green light to go, then you're ready, instead of then needing another 6 weeks of strength training to then be ready to go back to the activities you were doing. So, it doesn't mean sit around on the couch and get depressed. It means, all right, I got to work around this injury and just let it heal. And thankfully our bodies are really good at doing that, actually. So just talking about workup as it relates to injury, like if you come to see me in my office, often we're going to be talking about what we can do to evaluate further. So, in theory, this injury has occurred and you've tried the usual stuff, right? Peace and love. And unfortunately, darn it, you still got pain that's localizing, or maybe some swelling, or maybe you've got even mechanical symptoms of like catching or locking or giving out or something like that. And so a lot of times when you come to see me, we're talking about, well, maybe we need to get some x-rays, or maybe we should get an MRI to look at all those soft structures. So, MRIs are really very good at looking at bone and bone edema or bone swelling, but also looking at all the soft structures, so ligaments, cartilage, tendon insertions, etc. We do also talk about CT scans, and I think, sometimes patients are surprised when we're like, we do actually want to see what the alignment of these bones are, or, we really do actually want to see, more with the CT. So sometimes we'll order CTs as well. We are heavy users of the physical therapists out there because darn it, they know what they're doing and they're really good at helping us to kind of hone in on what muscles need to be strengthened, and what, what modalities can be used to encourage healing, right? And I love April's comment about sometimes she's just a reality checker, really, but I think that's true. And I think it is important that you've got a whole team of people around you who are giving you solutions to how to move forward with an injury, right? We do sometimes talk about injections. We're getting away from cortisone these days, especially in athletes. Cortisone is a really, really old steroid. It actually isn't even manufactured anymore, but we use something that's its cousin called triamcinolone or Kenalog pretty frequently, especially if it's an older patient who has had an aggravation of some underlying arthritis. Arthritis is tricky, right? Because we have no good solutions as far as putting cartilage back where it belongs. And so sometimes we're just talking about, well, let's get the pain under control so that your muscles work like they're supposed to, so that you can get back to the activities you love doing. That being said, we're spending a lot more time talking about platelet-rich plasma, which April didn't know she was alluding to, but she did, with staying away from anti-inflammatories, right? So anti-inflammatories inhibit platelet function. Platelets are just these little bags full of just awesome chemicals that are telling everybody in your system what to do, right? How to clean up the debris from a tendon injury, right? A meniscus tear, muscle tear, and then they are bringing all their little friends in to lay down some scar tissue, start that remodeling process of normal tendon, normal muscle. So they're super helpful for healing, and that's why really we've gone away from the anti-inflammatories. I tell people all the time, like, we would absolutely prefer that you use Tylenol or acetaminophen as a pain reliever, or frankly, ice is a really good analgesic. So, that's a good one. But if we can stay away from the ibuprofens, the Advils, the Motrins, the diclofenacs, all of them, we're probably setting you up for faster healing. And then, we do talk about surgery if it's indicated, and sometimes it's not indicated right away, but darn it, we're just not seeing the progress that we'd like to. And then we might end up having a discussion about surgery. There are lots of treatments now as well that can help us avoid surgery. So it's always kind of a fun discussion, honestly, with athletes who are, trying to get through their events and trying to, maximize their performance in that event without actually causing further damage down the road. And I think that's where, talking to somebody like April or myself can be really, really helpful for athletes. Yeah.
Yeah.
Go on.
Cool. Awesome.
I'll
Great.
let you wrap it up.
Okay, well, that was kind of our spiel. Yeah. So pretty much you want to understand like what you are required, whether it's, you're super serious about biking, or you're recreationally hiking, or you're whatever it is that your sport is. You want to understand what you're actually asking of your body and what you need to help for your body to actually do those things. You want to plan for your success, plan your loading program. Again, this I think comes up a lot with our seasonality of activities and how we love to just like, okay, it's winter and I'm jumping into winter things, and now it's spring and I'm jumping into my summer things, and just like thinking about that maybe a little bit in advance. Right? Maybe like pre-ski season, I'm going to think about getting strong for skiing, or pre-spring, I'm going to think about the fact that I want to go hiking or I want to go biking, and like working up to that. And then maximizing your capacity. Either way, sleep and nutrition and strengthening is going to make you feel like a great human. And then especially more so to help you with all your recreational activities. So just like trying to stay on top of it. And of course, we're not always perfect at those things, but at least recognizing when maybe we've had a lot of holes in our sleep and nutrition and our strengthening, and not asking too much of our body in those times. And then seeking out help, whether prevention or after an injury, like I said, just so that it doesn't go on too long, and we can kind of nip it in the bud. If you guys have any questions, let us know. Here's our information.
Thank you.
Thanks. You will